I'm the nurse practitioner student, and I'm going to do the head-to-toe assessment. And first of all, I'm going to do hand hygiene. And I'm going to introduce myself. Hi, my name is Tabda Sinaga, and what is your name?
Elisha,
Elisa, and how old are you?
18.
18. And do you know how you get here?
My mom picked me up.
Okay. And then can you tell me what day, month, and year today is?
January 9, 2024.
And what day?
To the Tuesday.
Tuesday. Very good. And then do you know what season are we in?
Winter.
Winter. And then do you know who's our president?
Joe Biden.
Oh, very good. So she is an adolescent and well nourished, well developed, clean hygiene, speech is clear, and her sexual development is appropriate for her age. And I'm gonna go ahead with the examination, the HEENT, head, eyes, ear, nose, and throat. First of all, I'm gonna do inspection, looking at her hairs, the eyebrows, eyelids, and also all are thick. The hair is thick, and also the facials is symmetrical with the symmetrical face, nose, mouth, lips are pink and moist. Let me see your eyes. Sclera is white, conjunctiva is pink. And I'm gonna take a look at your ear. The external auditory canal is clean. I don't see any discharge. I'm gonna take a look real quick. And same thing with the left ear. External auditory canal is clean, no discharge. And I'm going to start with the palpation. First of all, I'm going to start with the scalp. Sorry, okay. And don't feel any mass, non-tenderness. Hair is thick like earlier, and also no bulging, no baldness, no dandruff. And I'm going to go down, and I'm going to press the sinuses like this. Sorry, like that, this, and this. So the frontal sinuses, maxillary sinuses, ethmoid sinuses, and lacrimal gland, lacrimal puncti, non-tender to touch. I'm gonna go ahead with the temporal artery. I don't feel any tenderness. I'm gonna see the TMJ. Can you open your mouth and then move side to side? And then can you move your lower jaw forward? Very good. Non-tender, no crepitus on the TMJ. And I'm going to do another examination. First of all, the cranial nerve number 5. If you could just close your eyes. I'm gonna using this. I'm gonna ask you to locate where I put the item. Okay, ready?
Right cheek.
Very good.
Left cheek. Left arm. Right arm.
Okay, this is cranial number 5. The sensor exam is intact. And I'm gonna go ahead with, can you open your eyes and smile? And then frown your face. And also move your eyebrow. Facial expression is intact. That's cranial nerve number 7. That is 2. I'm gonna go ahead to do another eye examination by doing the pupil. I'm gonna use the flashlight for direct and consensual response. Okay, I'm gonna put my hand between. I'm gonna follow. Can you see my finger here? Very good. And then I'm gonna see your pupil. Okay, ready? Very good. Excellent. So the pupils are round, equal, 5 millimeters bilaterally, and constriction is 3 to 4 millimeters. I'm gonna ask you to look behind my shoulder and then follow my fingers closely. Very good. I'm gonna bring close right here, and I'm gonna ask you to follow my finger, but don't move your head. Are you ready?
Yes.
Yes. Excellent. Good. Okay, excellent. So no lid lag, extra ocular movement. Cranial number 2, 3, 4, and 6 are intact. That's the eye examination. I'm gonna go ahead with the ears. I'm gonna touch this, the tragus, auricle. Any pain or tenderness?
No.
Same thing with this. No tenderness, no pain. I'm gonna do look inside the tympanic membrane for any swelling. No discharge, no swelling. I'm gonna go to the other side. Thank you. Tympanic membrane on the right ear. No swelling, no tenderness. There's no discharge as well. So tragus, auricle are okay, non-tender or pain to touch. That's the ear, and I'm gonna go ahead with the nose, and then I'm gonna ask you to look up there and heads up. I'm gonna to put the flies on. Okay. The septal is midline, and the nares are patent. No discharge, no obstruction whatsoever. Good. I'm gonna ask you to. So that's the ear, the nose, and the throat. I'm gonna do the inspection using. Oh, first of all, I'm gonna ask you to open your mouth, smile, and see me your gum. No gum disease, and teeth are clean and white. Um, I'm gonna use this the tongue bit. Okay, can you put stick up? There you go. Thank you. Also, I'm gonna ask you to look up again, head up. I'm gonna see the hard palate, the soft palate, and then posterior pharynx moist, and also the tonsils are not enlarged, Stanton duct, Wharton duct are visible, and no gum disease. As I mentioned, I'm gonna ask you to push against my tongue bit here on your right side, now the left side. Very good. And I'm gonna depress. I'm gonna push your the tongue against the tongue bit. Okay, good. So cranial nerve number 9, 10, and also 12 for swallowing. Can you swallow? Are intact. Like I said, the tracheal is midline, no deviation. I don't feel any enlargement in her thyroid. That is the throat and oral, the ears, the eyes, and the nose. And I'm gonna go ahead with the lymph nodes. Okay. Sorry. Go ahead. This is pre-auricular, post-auricular, tonsillar, submandibular, submental, and this is superior cervical, posterior cervical, occipital, and down here is supraclavicular. They all are non-tender, no pain to touch. I'm gonna hold your shoulder and then can you push against my hand? Very good. So trapeze is good strength and resistant. That is cranial nerve number 11. And let me see what else again did I miss. The eyes are done. Oh, the olfactory number 1. Can you close your eyes? I'm gonna ask you to smell this.
Alcohol.
Alcohol, very good. Thank you. That is done. Now I'm going to. I think I missed this one here. This is the Snelling chart. I'm gonna ask you to read the numbers below here.
472-01685.
Very good. So the Snelling chart visual acuity for her is 20/20. Excellent. Thank you. I'm gonna move down here, and that is the head, ears, eyes, nose, and throat. And I'm going to let me see what else. I'm gonna start. Okay, with the thorax, lungs. First is inspection. The breathing, the respiratory rate is normal. I don't see any abnormality, and I'm going to see the back here, costal angle. Any tender?
No.
Okay. Percussion, the CBA percussion. No. Okay. Lean forward a little bit. Can you chin down? Okay. Very good. I'm gonna take a look if there's any skin mass, tenderness, nothing there.
No.
Okay. This is the paraspinal column. Okay. Very good. And I'm going to auscultate the lung sounds on this region, the upper here, the subscapula, the right mid-lobe, using this stethoscope. I'm gonna ask you to take a deep breath and breathe out through your nose. Okay, ready? Take a deep breath. Very good. Excellent. Take a deep breath again. Exhale. Deep breathing, exhale. Exhale one more time. That's good. So lung sounds are clear, no adventitious sounds, no abnormality. And up here is vesicular, subscapular is bronchovesicular. I don't hear anything crackles or rails or wheezes. The same thing with the clavicular and also the sternal area here, sternal chest. And the sternal sounds and vesicular sounds, no adventitious sounds, no abnormality, lung sounds are clear. That is the thorax, the lungs, And I'm gonna go ahead with the cardiovascular. I'm going to inspect the JVD and the PMI from the location here, the JVD here. I don't see any distension. I don't see any bounding hips or lips in her cardiovascular. I'm going to check the cardiac landmark. The aortic valve is in the right and right sternal border, second intercostal space. Pulmonic valve is on the left sternal border, second intercostal space. Upper point is the third intercostal space and also the left sternal border. And the tricuspid in the epigastric area, left sternal border. At the last is mitral valve, sorry. At the fifth intercostal space and mid clavicular. That is the cardiac landmark. And I'm gonna go ahead to do another auscultation using diaphragm for the heart sound and the bell for any aortic bruit, okay? Aortic valve, pulmonic valve, or points, tricuspid, and the mitral valve. Very good. And using the bell. Heart rate is regular, normal written. Same thing with this upper point, tricuspid, and this mitral valve. No aortic bruit. And I'm gonna do another palpation to her carotid artery. One type here. Pulses are palpable. Very good. And I'm going to ask you to turn left side, and I'm gonna ask you to take hold your breath for 5 seconds, okay? 1, 2, 3, 4, 5. Let go. And go to your right side. I'm gonna listen again, carotid artery for any bruit. Let go. Okay, no bruit. That is the cardiovascular. I'm gonna ask you to lay down. We're gonna do the gastrointestinal assessment. Her abdomen is flat. I don't see. I'm gonna take a look real quick. No masses. Do you feel any rashes or do you see anything? Any tenderness? Okay. And I'm going to auscultate first for bowel sounds. First of all, I would say probably auscultation first. Okay, and I'm gonna do the auscultation first with diaphragm. Full region. Bowel sounds are active. And the bell for any aortic bruit. Same thing here. Okay, good. And there's no bruit. And I'm going to do the only light palpation, and after that deep palpation to check for the organ abnormality. Okay, this is light. Any tender? Okay.
No.
I'm gonna do deeper. No. Very good. Tickle, huh? Okay, good. Any pain, tenderness?
No.
So I finished with gastrointestinal assessment, and I'm gonna go down to musculoskeletal, continue with the neurovascular assessment, starting with the dorsalis pedalis is palpable pulse, posterior tibialis palpable pulse, and this is popliteal, also palpable pulses. Skin is warm, the hair, no issue with that, no swelling, no tenderness, no swelling, no redness. I'm gonna check for calf refill is brisk. Thank you. I'm gonna put it away, okay? And the same thing here. Calf refill is brisk. I'm gonna also ask you to move your foot front and back and push against my hand. And the same thing too. Move side to side. Okay, and the same thing with this. Range of motion for the ankle, the foot. Very good. I'm gonna ask you to bend your left knee. Okay, I'm gonna push against my hand. Very good. And then back here. Okay, any pain? Okay, good. No crepitus, no tenderness. Same thing with your right knee. Bend your knee, push against it. Okay, no crepitus, no pain in her joint. I'm gonna go to the hip, and this is the femoral arteries, and then it's palpable. I'm gonna move your hip, Side to side. Any pain?
No.
Okay. Same thing with this. The hip, any pain?
No.
Very good. And that is the lower extremities. And I'm gonna ask you to sit up. And I'm gonna have to see your hand like this. Move your hand side to side, very good. Up and down, and then the elbow, your shoulder, very good. So able to move. I'm gonna ask you to push against my hand. Sorry. Perfect, thank you. See your hand. And calf refills are brisk. I'm gonna check your radial pulses. And then also this is the brachial pulses. They all are palatable. I'm gonna ask you to stand up and cross your arm. Twist your back. Very good. Lean forward, lean backward. Any pain?
No.
Okay. And I'm gonna ask you to, can you stand up from here and doing the heel to toe, 3 steps. 1, 2, 3, and backward. 1, 2, 3, very good. I'm gonna ask you to stand up on one leg and then bend your left knee down. That's your right knee, okay? The other side again, sorry. And then bend, very good. And then put your feet together, close your eyes. No swing, so Romberg sign is negative. I'm gonna ask you to sit down again. And I'm also going to check for your deep tendon reflexes. Okay, good. And then also the bicep. Okay, the deep tendon reflexes, patella and the biceps are intact. And also I'm going to, let me see what else did I miss. Hold on a second, okay. I think that's all it for deep tension. And also, oh yeah, I'm gonna ask you to close your eyes. I'm gonna get your palms. And this is to test for gravitysia. I'm gonna give you the number, okay?
4.
Very good.
7.
Very good. And the gravitysia is intact, is normal, and I'm going to do the neurological exam. Okay, are you ready? I'm gonna give you 3 words. It's a bird, check, and flu. Bird, check, and flu. Okay, and I'm going to ask before you leave the house, and what do you do?
Lock the door.
Lock the door. Can you repeat these phrases? No, ifs, and, or, but.
No ifs and buts.
Or buts.
Or buts.
That's fine. And also, I'm gonna ask you, do you know what this is?
A pen.
Okay, very good. A pen. And also, okay, this is the numbers. I'm gonna ask you to count backward 20 by 3. Starting from number 20, backward 3 by 3.
20, 17, 14, 11.
Very good, thank you. Can you remember that 3 words we mentioned at the beginning?
Bird, check, and flu.
Very good, thank you so much. So her short-term memory is intact and as coherent for all the assessment I've done, and that is concluded our assessment. Thank you so much.